This is a post-hoc analysis of quantum-R, as essentially all of these are, since the primary data for that trial has actually already been published. quantum-R was a randomized study of patients with FLT3-ITD-AML who were relapsed or refractory, and those patients were randomized to receive either conventional salvage chemotherapy or single-agent quizartinib, which is a very potent selective FLT3 inhibitor. The trial was positive in that there was an overall survival benefit for patients randomized to receive quizartinib, but there were a number of other issues that we wanted to drill down on, and one of the ones was transfusion independence. So as a approval endpoint or a regulatory endpoint, it has come to the attention of a number of us in the field that in fact a demonstration that your drug can improve quality of life by decreasing the dependence of our patients on having to come to the clinic and get blood transfusions is important. And in fact, even apart from a benefit in overall survival, a regulatory agency will look kindly upon the fact that we are improving our patients' quality of lives. So it turns out in quantum-R, in patients randomized to receive quizartinib, there was an improvement in transfusion independence. And so the study measured patients' defined transfusion independence and set it at baseline, and then asked during a 60-day window of treatment, did they at any point become transfusion independent? And in fact, 22% of patients on that quizartinib arm became transfusion independent. This compares with other FLT3 inhibitors or other targeted agents. It gets it into that same ballpark. And so while this is just one of the parameters that we have been looking at post hoc, this was an important one because, okay, many of our agents, do they result in a cure? Not necessarily. They're prolonging survival, but are they also changing the nature of what the patient's going through? Quizartinib is an oral agent that you take and you're at home. Chemo you take inpatient in the hospital. Not only are you at home, you're not needing transfusions as often. So that, I think, is the point of the abstract.